All right, so today we're going to be talking about throughput. Okay, throughput. And you might ask yourself, why is throughput important? Well, if you remember the clip I shared about the levels of care, think of 46-year-old male, has an accident off the highway. EMS is the first level of care, second level being ED, and then there's ICU or OR, or whatever the case may be. Going from one point in healthcare to the next is a flow, and it requires the elimination of bottlenecks. Bottlenecks are things that keep you from progressing. So having throughput as a strategy in healthcare operations is truly important. So throughput is important. But there are three things I'm going to share with you about throughput that are truly important, or three areas that are truly important. First one is your clinical departments. And think of, again, that case study, ED to maybe ICU directly. If there are 30 beds in your ICU and in your ED, you only have just enough. But there are probably multiple accidents, probably 100 plus coming into your ER quite often. You need to make sure that your clinical departments have the tools they need to do their job. You see me write this SBAR, situation, background, assess, and recommendations, a tool that they can use to communicate to ensure efficiency. The next area is EVS, often under-celebrated. Environmental services. You know why they're important? Because a patient leaves one room and that room needs to be cleaned and turned around. The third area is your, call it access / case managers. And they could be access to include bed board, where you're talking about, does that patient have a room in the ICU or in the med surg, or case managers, where they need to talk about going to the next level of care, i.e. the LTAC or whatnot. So throughput is an important part to make your beds available. Bed availability is a term you might hear. Availability is truly important in hospital operation. Thank you. See you in the next video.